Hi, Dr. Shire here.
And Dr. Scott.
And this video is called Pulling It Apart to Put It All Back Together. And what does that mean? In this video series, we've explained a lot of things to you, a lot of conceptual ideas. But if there's one takeaway that I think you should come away from this knowing is this. There are many facets to one's health. There are many reasons why people have issues, conditions that befall them. And the most important part that I feel, and I think I speak for Dr. Scott as well, is it is important to pull things apart. Let me explain. We see a lot of neuropathy patients, a lot of knee pain patients. And to simply say that, oh, this person has neuropathy, they're a diabetic, that's why they have neuropathy, is unacceptable. To simply say that, Mrs. Jones, I looked at your knee, you have arthritis, call me when you think you're ready and we'll replace it. That is unacceptable. And the reason is because there are so many different contributing factors to one's health. We've talked about it in this video series quite a bit, but I feel like it's so important it can't be overstated. For instance, if you're dealing with a knee problem, how do you know that your knee can't heal? How do you know? You're going to take it on someone's word, right? But what if that word is inaccurate? Sometimes it will be accurate, maybe sometimes it won't. So what I mean by pulling it all apart is, what if really the knee problem is more a byproduct of your inflammatory lifestyle? Here you are changing the knee out, but still eating this highly inflammatory diet. Or what if it's a combination, what if this knee problem is a combination of an inflammatory lifestyle combined with some spinal stenosis, right? Combined with a small amount of knee arthritis. This will create a very confusing, soupy picture, as we call it. So it is really important when you're working with patients to pull things apart. What's going on with a person's lifestyle? What's going on in their life? What's going on with their nutrition? What's going on with them mechanically? What's going on in their history? What clues are you getting from this individual that might paint a very broad picture? Because sometimes a knee is a knee, but sometimes a knee is so much more. Sometimes neuropathy is simply neuropathy, and sometimes it's so much more. And what we've had our best success doing is pulling these things apart, looking at them individually to put it all together to make a comprehensive picture for the patient that makes sense. And then you test these theories, you test your ideas, and oftentimes these very conditions that seem so insurmountable, these problems that seem so impossible, can oftentimes be resolved naturally without any medicine or surgical intervention. At least that's our experience. So.
Yeah, and it is amazing how many patients out there are just suffering long-term with issues that they've had all kinds of treatment for. They've seen many doctors for it, and really just haven't got any long-term relief at all. And they just at some point feel like they need to give up on it. And the human body is so powerful at healing itself, given the opportunity. It just takes what Dr. Shire just explained, which is really taking the time to pull apart all the different situations so that we can address the real issue behind the problem in the first place. And that's the way you overcome these chronic degenerative conditions that otherwise go on forever.
All right. Well, thanks for joining us. If you have any questions, ask us at your next appointment. Ask Dr. Scott or myself. And again, we want to thank you for watching, and we'll see you soon.
Thank you.